Thank you, Program Director, for the warm introduction and the welcome. I'd like to acknowledge the University Council members present here and the representatives from the University Management and the Executive Director of UJ Library, Dr. Bawa, and the team, the representative from the Health Sciences faculty and other faculties that are present here, the various campus student formations, the students, ladies and gentlemen, Sanbonani, Dumelang, Sanbonani. It sounds more like it. I think for me, before I begin with my address, I felt that, the issue and the subject of discussion needs a human element in it. And therefore, it is my honor and privilege to call upon a lady, Omatina, to share with you her story before I even begin addressing you, if you permit.
I'm too short. Good evening, ladies and gentlemen. Dumelang. Dumatewani. Let me first acknowledge the presence of our First Lady, Mama Tobeka Madiba-Zuma, for inviting me here in this house of UJ and the UJ family. I've got a milestone journey that I've traveled. I'm enjoying it now because I've got benefits. I'm an HIV activist, a victim of rape. In general, I'm a victim of circumstances. 2004, I was raped from work by a taxi driver. The same year, I was diagnosed with HIV. It's so hurtful to be diagnosed without having a plan of it. I never thought it will happen to me. I never thought I'll one day be raped. And I never thought I'll end up having HIV. I was diagnosed with HIV 2004. The most fortunate part is that I had a good, loving, supporting family. My family has been behind me all the way, my friends and relatives. 2005, February, I was diagnosed with pulmonary TB. And I was not aware that I have pulmonary TB up until I got tested. Sometimes we've got illnesses that we cannot even diagnose them ourselves. I only felt a pain on my left next to my breast. I just go straight to the clinic. I was checked. They say I've got pulmonary TB, and it was very severe because they say my lung was like a tennis racket, so it was already damaged. But I did manage to pull through, take treatment for 8 months. Then I got a certificate. We don't only get certificate at school. Even when you follow the right precautions, you get rewarded. I got my certificate in the same process, same 2005, 5 May. That's why I started to take the ARVs. And I feel very much grateful for our government, because if it was not them, most of us will not be able to be here. 2005, I started taking treatment. 2007, I was diagnosed with cervical cancer. You can check the path that I was walking on. It was very, very difficult and very stressful. But I did manage to pull through because God has been there on my side. Because after being diagnosed, I asked myself only one question as to where do I go from here? Can't I be the driver of my own destination? Really, I was the driver of my own destination. Because as I speak now, I've got full 10 years living with HIV. and a survivor of cervical cancer and TB at the same time. I followed the right precautions and take treatment. In 4 months down the line, I was cleared from cervical cancer. They conducted the biopsies, I think 3 times, then I was cleared. The message that I've got, especially to ladies and gentlemen, it is best and it is for your advantage to know your body and to have a healthy living lifestyle. To students, I don't think you are here by mistake. By your parents to take you here at UJ Family, they've taught you something like responsibility. You are here on your own. You have to take your own responsibility. I don't think if you can have headache, you'll say, Mom, I've got headache, what can I take? You start to be accountable. So be responsible for your own health, for your own living lifestyle. Don't you ever try to compromise for your health. Sometimes we end up compromising and making other people happy before we can make ourselves happy. Now it's winter time. Parents think that we are in school, not knowing that we are gallivanting around Hillbrook. At the end of the day, you become a victim like the way I am. You'll end up having early pregnancies at early age, being HIV infected, having cervical cancer, because you don't know how to say no. Take your book and make it your friend. Your happiness comes first. As I've said, responsibility and accountability has to be within you. Teach yourself to say, I am the driver of my own destination. And you need to be the change that you want to see in your life. With these few words of mine, I don't want to waste any time. Working together, we can achieve more. Thank you.
Thank you so much, Martina, for sharing with us such a moving story. And I have no doubt that, you know, with her telling the story, it goes in a long way to save lives. Because not only does it give hope, but the story of Martina is an inspiration, even to me personally. So I'm glad that the students are here, and I hope they take note and take her advice seriously and implement it. Thank you for inviting me to be here and share with you the activities of the TMZ Foundation with regard to particularly activities around cancer awareness in South Africa. With universities being premised on continuous search for solutions to so many vexing challenges and ever-changing phenomena that affect and intrigue mankind, including disease, this automatically implies that UJ and TMZ Foundation are allies and stakeholders in the quest to improve the lives of the people in our country. We are all custodians of our National Development Plan, which has as one of its focus on healthcare for all, seeking to reduce significantly the prevalence of non-communicable diseases among the people of South Africa. We seek to build a healthy nation, to enhance quality and lead very productive lives. We are all important agents in the success of our nation, as imagined and charted in the 2030 vision. It is for this reason that the TMZ Foundation sees you an important ally and stakeholder in fighting the scourge of poverty and disease in our communities. Ladies and gentlemen, South Africa faces a quadruple burden of disease made up of communicable, non-communicable, perinatal, and maternal and injury-related conditions. The communicable disease spectrum is dominated by HIV, TB, co-epidemic, with other sexually transmitted diseases also prevalent. The major NCDs in South Africa are cardiovascular diseases, diabetes, cancers, chronic respiratory diseases, and mental illness. A report by Stats SA on mortality and causes of death in South Africa, conducted in 2010 and released in April 2013, shows that cancer is on the rise, with neoplasms ranked 6th amongst the main causes of death. Cancer remains one of the major killers, threatening the socio-economic development of South Africa and Africa at large, and has a significant health impact on the South African population. In all its forms, it is a very dreadful menace to the people all over the world. It's draining on resources and hope, sometimes crushing in the spirit. In addition to South African statistics, the World Cancer Report of 2014 indicated that annually 8.2 million people die from cancer in the world. More alarming are projections that this number might grow to more than double by 2030. As we all understand, it is always the poorer countries and the developing world that usually bear the brunt of disease. Disease and other factors such as underdevelopment, poverty, and illiteracy usually constitute, as we always say, a toxic mix in the quality of lives of the people in these countries. Cancer also soars the oncology costs in healthcare drastically, and some medical aid companies in South Africa are already acknowledging this pressure, particularly in the past few years. While the National Development Plan says that we have to, as a nation, address the social determinants that affect health and disease, we also have to engage the current paradoxes of cancer emanating from both our affluence and poverty, arising also from lifestyles such as unhealthy diets, obesity, smoking, excessive intake of alcohol, and air pollution, which is from our environment. Cancer can be associated with affluence and development to some extent on the one hand, while on the other hand, poverty also makes people prone to it because of lack of awareness and preventive measures. Coupled with the startlingly low numbers of oncology specialists across the entire continent, the challenge of cancer in Africa is an emergency to which we must collectively rise like we did with the other diseases that were threatening humankind. In South Africa, projections are that 1 in 4, of which some say in 5, South Africans will develop cancer in their lifetime, and that the number is growing. The big issue is finding out in time, which we call early diagnosis, which is not always possible for the poor people. In the face of this great challenge of the burden of disease in our country, through the TMZ Foundation, we decided also to enter the fray since 2010 to contribute our fair bit in this situation. Our organization works tirelessly seeking to promote healthy living, especially for the poor in our rural areas who are far from the resources. When I arrived here this afternoon and I saw a picture which was put up on the screens, and I was like, who is that? Because I could not recognize myself. And I think the picture must have been taken around 2010, yes, 2010. And it was twice myself, what you see in front of you. And so the management was saying to me, you've got to share with us what you've done. And I said, it's very simple. Sorry, I've got a a bit of flu. I said it's very simple. It's healthy living and it's healthy, following healthy lifestyles. And I think for me, it wouldn't make sense to stand in front of you, being obese, and say you need to be healthy, you need to lose weight, we're fighting obesity, and I'll be size 50. So I first had to challenge myself to say, how do I rise to the challenge posed by obesity in my own life? So I can be able to, better encourage other people to follow suit. And I took a decision when I approached 40, and I said, I need to add more years to my life and life to my years. And when I took that decision, I had to stay committed to it, in that also I had to ensure that I did it the proper way and the healthy way. And not through crash diets wherein you are told that you need to eat only all grains the whole day, starve yourself to death. It was only by going to the doctor to say, can you check and see what would work for me? Of course, he had to profile me and medically, and to say that because for no diseases that are threatening you, this is the eating plan. For me, it's not a diet per se, it's a way of living. We've adopted, I think our mistake was to get excited or adopt the westernized way of living. And that is why these diseases that we see that are called non-communicable diseases are called lifestyle diseases too. Because it's what we do that places our lives at risk. At least we know for cancer, 1/3 of cancers are largely preventable. And if we were to see to it that we make those few changes that are within our means to live healthy and lead healthy lifestyles, and be mindful of what we eat, and not abuse alcohol, cut back and cut out completely the smoking, because for me there's no benefit. If I were to ask a person who's smoking as to what sort of benefits do you derive from smoking, and the answer is none. And whilst I say that, I think my message would not be balanced if I say, as a country being placed in this unique position of influence, we need to also ensure that industry takes responsibility. That our industry does not put forward misleading messages to say it's cool to drink, and even put those well-known people on their advertisements, misleading our people and giving them wrong messages, and saying that it's cool to smoke, and even making the boxes so fancy that it looks really cool to smoke when it doesn't. And when we say industry, and it means joining our Minister of Health when he calls on industry to be responsible, not to put profits before the lives of our people, because that's what they do. They're only worried about the profit margin, the bottom line they call it in accounting terms. But if you really look at what does that do to our society, it is misleading our society. In their advertisements, they are making it look glorious to do all sorts of things. So when our Minister of Health really takes industry on, we shouldn't say, because I have seen it on TV, saying, Minister cannot tell me how much salt I should take, because the very same salt is going to place your life at risk for hypertension and other medical problems. And, for the poorest of the poor, when I talk about salt, I think of bread. Bread has got the highest salt content. And who consumes bread? The poorest of the poor. It becomes their breakfast, lunch, and supper in the rural areas. And that is why we see so many of our people with hypertension and all these other chronic illnesses that are problematic, that are claiming their lives. So we need to join forces, and we need to listen to these health messages that we put forward to say, this is what you need to eliminate. Sugar, refined. Try and reduce. It's not easy. When you take that decision, though, and you stay committed, you are highly likely to succeed. It is not easy, but it's doable. Then because we've got people from the medical faculty, they will back me in saying that, in that when you adjust and you're trying to get rid of sugar or anything else, it takes 14 days to adjust. And when you adjust, don't give your bodies a shock. Do it gradually. And eventually, after 14 days, you will find that you're not a prisoner for sugar. You can do without sugar. You can do without salt. So it is very important that, we join forces, we work as a collective. Not one singular sector can actually solve the problem posed by cancer and these other diseases. It will only take a collective. It will take the universities. We rely on them, on research, to inform us, scientists. It will take the non-profit organizations to join forces. It will take the civil, ordinary citizens to join forces, the other NGOs that are working in this space, to ensure that we work as a collective, to highlight the dangers that are posed by these diseases. Because often people don't die from these diseases. They actually die from the lack of knowledge. And it's even worse in the rural areas where they've got no access to information as much as we do here. So we need to try and work together to ensure that we take the very services, the information, the education to the rural areas. Because in the rural areas, you're not only faced with issues of stigma, but you're also faced with issues of culture, wherein our women need to go and ask for permission from their husbands to say, can I go and have my body touched by another man or another woman examined? You may frown upon that, thinking, because you are in the urban areas, thinking that it's not possible, but it is. When we work in the rural areas and engage through community dialogues, that's when we come across these challenges. And that is why, for me, it's very important that as much as my foundation focuses more on female cancers, but we don't leave men out of the equation. We need men in the equation so that they are also educated, so that they also have a better understanding of why their spouses ask for permission to go and have their bodies examined. Because for us, the only way we can combat the disease or rise to the challenge is when we strengthen our screening and we ensure that screening is available regardless of where you are geographically in this country. That our people have got equitable access to screening services. And that our people, when they are screened and they are diagnosed, they are able to be sent to tertiary institutions for further investigation, timelessly. That when they then found to be diagnosed to have these diseases, that they are put on treatment, the lead time is shortened between the time of diagnosis and the time they are put on treatment. And that when they are on treatment, they are fully supported, not only by the healthcare system, but also families. And I think for me, that's the reason why we are together here under one roof. The importance of families, the importance of getting support, which Martina shared with us, that she also could survive all these traumas that she went through, all because she had a very supportive family structure and support system. So it is very important that we educate our people, that they provide support, and in doing so, it will also help drive away the stigma that exists around these diseases, wherein when people are diagnosed, the family doesn't know how to respond to the challenge. They start allocating different utensils and crockery to this newly diagnosed member of the family because they're scared that they're also now going to contract this disease, and it's not really the matter. But when they're educated, we can be assured that our people, when they're diagnosed, they are assured of life beyond diagnosis. And I think for me, the story of Martina is such an example that there's life beyond diagnosis. Provided you are diagnosed early and provided that you're put on treatment early enough, you can survive the disease. One of the people that are here today, I know that we are against time, that I'll also share with you her story, is Pungi Maloi. I need her on her feet so that we can all see her. Pungi Maloi is married to a gentleman who we all knew back then, who was a striker for our country, Bafana, Mr. Maloi, and also Pungi was here goalkeeper at some point. Yes, he really made us proud back then. And she's a breast cancer survivor. Not only has she shown cancer the door, she has actually given us hope as women that you can still go back to the bearing of children. She's just had a baby, a small baby, who is now how many months? 5 months? 3 months old, yes. After she battled it out with breast cancer, but she was fortunate that she was diagnosed early. And living in the urban areas, you would also expect that when you go to the doctor and you say there's something wrong, because our bodies sometimes can tell us that there's a lump on my breast, the doctor would really take the necessary precautionary measures to eliminate anything that might be linked to cancer or anything of that sort, especially if it's a lump. And she was told that, no, you're approaching that time of the month, that's probably why you've got a lump on your breast, go back home, you're fine. And I'm telling you now, and I'm urging you now, and you spread the message, when the doctor tells you that, you mustn't just go back home and sit and wait for the lump to get bigger. Not every lump is cancerous, please note. But she went back home and she decided, no, I am not going to take that, I need second opinion. She went, and fortunately enough for her, she had medical aid. So she went for a second opinion. Said, doctor, I'm not happy with what I was told, can you look into my breast? The doctor did look into her breast and found it and diagnosed it to have cancer. So she called her into the rooms, she told her that she's got cancer. And those 3 words, ladies and gentlemen, those 3 words can leave you feeling like the world is coming to an end. So she then, of course, went back. Spouse was there, supportive. They Googled, they checked, they read. They really went all out to get as much information as possible, because information is power. Once we're empowered with the knowledge, because for us we fear the unknown, but once you have the information is power. You are able to make informed decisions, and you also fear nothing because you know what to anticipate. So she went back home, they checked what needed to be done, and of course she was started on chemo. And for her, the journey with chemo was not a pleasant one. So you can imagine with Martina, she's HIV positive, she's taking ARVs, now she has to go on chemo. And most of us would know that chemo is is not friendly to our bodies. And we all respond differently, but we know that before you get better with chemo, you go down. Why? Because it first wipes out all the white cells that you need that will fight for you should you have flu or anything of that sort. So when you are on chemo and you get flu or you get an infection, you can potentially die because you've got nothing that fights for you in your body. But again, then the white cells start building up and you then gain your strength because you also lose appetite. There are all sorts of things that happen that might scare you if you're not empowered with enough information. So she went through the journey with cancer, breast cancer, and in the end, I refer to her as a warrior. She was victorious in that she was cleared, she was given remission, and she could even engage with the doctor on the subject of, doctor, I've only got one child, I need another one. And of course, she didn't even wait that long. She just had her boy 3 months ago. And that for me, ladies and gentlemen, is the power of information. And that is why I'm sharing with you the stories. I said with cancer that there's a human element in it. That is why I brought them along. I worked with them within the foundation so that we give people hope. but we also inspire them that they must take charge of their lives. Because once you take charge of your life, you are in control, you are the driver. You are not controlled by the diseases or the lack of knowledge. And therefore, when we work with all the relevant stakeholders, we realize that the common denominator is the issue of funding. Funding has been channeled towards fighting HIV/AIDS. And I think as a country, we can safely say now, we've got HIV/AIDS under control. It's no longer the other way around, where HIV 10 years ago had us under control. In that even when you go to the European countries, you would not be proud, and you will forgive me, Dorcas, and the supportive doctor that was sent by the Ministry of Health, but probably it was not during your time, Mentena, in that, we were a country at some point in our lives that could even talk about beetroot. About garlic. Was garlic and beetroot? Yes, it was garlic and beetroot. Because I can remember I was in a very important meeting in Paris, and there I'm presenting up from South Africa, and the health space, and what have you. Like, oh, the country that relies on beetroot and garlic. And I must say that it was very embarrassing for me. But I think as a country, we've come a long way. We've taken bold steps as the country, and we are now reaping the fruits and benefits for having taken those bold steps to respond to the challenge which was posed by HIV/AIDS. But while doing so, the foundation took an approach to not only look at cancer in isolation of HIV/AIDS. That is why our programs include cancer, HIV/AIDS, because of the strong relationship which exists between those two. An HIV-positive woman is at a higher risk of getting cervical cancer, because cervical cancer is caused by HIV, HPV, the human papillomavirus, that you get sexually, it's transmitted sexually. So it is very important for us to look at those and fight those battles together under one umbrella and not fight one in isolation of the other. But of great significance, I say, as the First Lady of the country, I don't have the executive powers, but I sure sit next to the executive seat every single day. And for me, it was a question of how do I use that unique position of influence to champion the issues that affect our women, to speak for the voiceless, to ensure that our women don't die premature deaths, premature, painful deaths in their productive years. How can we ensure that our women are not sitting at home sick instead of playing a meaningful role in the economic growth of our country? Hence, I then started the foundation, because I didn't believe in this silver platter which was presented in 2009 to me to say, now by default you've become the spouse of the president, what programs are you going to do? I couldn't say I'm going to use the presidency. That's why I started the foundation, because for me I wanted to leave behind a legacy that will ensure that our women don't die premature deaths when we know what needs to be done. And starting the foundation was to ensure that my work is not linked in any way to the term of the president, whether it's one term or 2 terms, but my work continues even beyond. And when I was in New York in 2011, Margaret Chen did pose a question, which I'm also going to pose to each and every one of us present here. And she said, if not us, then who? She said, if not now, then when? So there's no reason for us to fold our arms and wait and see our people dying when we know what needs to be done. But we need to join forces, work together, use the information that we have at our disposal to save the lives of our people. But having said that, I also would like to try and balance that message in that South Africa should not be a nanny state. South Africa should have responsible citizens that are going to act responsibly, that are not going to put their lives at risk, and with the hope that because the government is the custodian of its people, I'm going to run back to the government to say, now I'm sick. When a person lands up in hospital, it's the end of the stick. So that is why my foundation is very strong on preventive measures, on promoting preventive messages across the board on how can we even prevent the onset of these diseases that are claiming our lives. So it is very important that whatever we do it together as a collective. As I said, there's no one singular sector that can solve the problem. It will take a collective for us to work together in ensuring that we also mobilize resources. Because we saw last year, as a country, South Africa is a middle income country, so which places us in a very awkward position. But we saw last year what our Minister of Health did. He took a bold step after we were busy lobbying him to say, Minister, started in 2009, to say, Minister, when do we vaccinate our young girls? And he said, okay, ma'am, I'm still dealing with HIV. And I understand and appreciate the fact that he's got competing health priorities before him. But then again, we need to think about the future, saving the lives of our daughters. That as a country, we know that there is a population of girl children that we know in future are safe from getting cervical cancer. And of course, being the minister who is an ear and open-minded, he was able to say, I'm going to approach Treasury. I'm going to see how we can get the very funds, Madam Zuma, and then start vaccinating our young girls. And I was there when we launched the first vaccination program. And for me, it was that aha moment, because as a country, it was a huge milestone, something that was not even close to my heart, in that we would at least know that there are girl children that in future would be safe from getting the disease. So that is how I also use my unique position of influence. And I've always told them that, if you want things to be championed properly, you can give it to me, because there's nothing as powerful as pillow talk. You can get ministers coming with presentations and papers and thick files and what have you, and I look at them and think, mine is going to go first and mine is going to go first. So ladies and gentlemen, with those few words, let me tell you how delighted I am to have spent this afternoon with you. And our students are our future, our kids are our future. Madiba did say that, when we invest in you, we know that our future is guaranteed to only be bright. So it is very important that we invest in you, not only academically, but your health as well matters, because it's pointless for you to be studying and then 7 years down the line, you can't even begin, to practice what you've studied, and you are sick and we bury you. It would be it's not a natural process for a parent to bury a child. So it's very important that we stay focused, as Martina challenged you, focus on your books, ensure that without discounting human resources as an important thing to do, but we need to see more of our people if we are to respond to the issue of poverty, studying other, being in other faculties that are your medicine, science, and what have you, and we'll probably then reap more benefits of the likes of NSFAS and what have you. But then I'm not an academic, it's just my 2 cents opinion, in that we would like to see more of our children from the poor background, tackling these other challenging studies. We want to see them going to the moon. I've had the opportunity, to go and visit in New York, the area where our wonderful, what is his name? From South Africa, Mark Shuttleworth, where he departed from. And for me, it was quite interesting, and I thought, wow, when I go back home, we need more of our people doing science, in medicine, and what have you. So with the few words, I hope I've inspired you to ensure that the knowledge that we shared here under this roof does not remain here. When you go back home, educate your moms, educate your dads, say, Dad, sorry you smoke in our presence, smoking in our presence, you're making us secondary smokers, with such respect though, because otherwise you're going to yield different results and outcomes. To say that you're making us secondary smokers, can you please, you promise me? Thank you so much. Thank you for listening to me.
The University of Johannesburg. Rethink, reinvent.